A new national survey has found Canadians to be deeply frustrated with primary health care in this country. A 72-page report found evidence of what it calls an attachment crisis, that an estimated 22% of adults don't have a regular family doctor or nurse practitioner. That problem is worse with young adults and in some provinces like Quebec and those in Atlantic Canada. The report calls on governments to accelerate licensing of foreign-trained healthcare professionals and train and recruit more people to work in primary care. I want to bring in Canada Tonight's medical contributor, Dr. Samir Gupta, for his thoughts on this. Dr. Gupta, welcome. Good to see you.
You too, Sarah.
So,
I think.
Yeah, go ahead. Well, I was going to say, what stands out to you when you hear about the number of people who are so frustrated? I mean, that's a lot of people who don't have primary care access.
Yeah, it's something, Sarah, we've talked about on this show, and I think it kind of puts numbers and some objective data around what we've subjectively, what you hear people in the community saying, what I as a doctor hear my patients saying, and what we hear about in the press, which is this massive number of people, and in this report, it's 6.5 million Canadians who don't have regular access to a family doctor, a place they can call home, a place where somebody knows their history and somebody can see them regularly. And that's over 20% of Canadians. And also what comes out is, to your point, it's the frustration. And this is the number one thing. If you ask about, what can we fix, what's the reform that we need, it's access. And that's what comes across geographies, across demographics. That's what everybody's concerned about as their number one frustration. We want access to a primary care physician.
Dr. Gupta, what kind of impact can it have health-wise on this, as you say, massive group of people who don't have this access to a healthcare professional?
Yeah, it's very concerning. I think the obvious thing is when you need someone for a problem you're having acutely, you don't have someone. And so in some cases, people will end up in the emergency room, and that has impacts on other parts of the healthcare system. But we often forget about the very important preventative role that family doctors play. Family doctors do a lot. And they're sort of the quarterback for somebody's care. And somebody might be seeing 2 or 3 different specialists, but the family doctor is the person who brings it all together. But they also do a lot of routine preventative stuff. They will do screening stuff. They will sometimes prevent diseases from occurring, but very importantly, they'll identify diseases early and treat them so that they prevent them from progressing. And so there are a lot of long-term health consequences from not having that at an early stage.
When we talk about increasing the workforce, and that is billed as one of the solutions here, how quickly can something like that actually happen, and how much does that cost?
Yeah, I mean, it takes 6 years to train a family physician, 4 years of medical school and 2 years of residency. A little bit faster is getting current medical students to look at family practice as a career. And to do that, we're going to have to make it more attractive. We're going to have to make work-life balance better, work conditions better. But even more immediate is the possibility of bringing foreign-trained physicians back into our system. In many cases, those are Canadians, Sarah. It's folks who couldn't get into medical school here, went elsewhere, and then due to a lot of red tape couldn't come back here for their family practice residency, or they're fully trained and can't come back. So that is a faster solution. And yes, all of these solutions cost money. It costs money to train folks and to employ more doctors. But again, coming back to the prevention piece, this is one of those things in the health system where that early investment, that sort of stitch in time, can save 9, where if you get a family doctor who sees someone and, for example, identifies high blood pressure and controls that blood pressure, you will save that heart attack or that stroke that could happen 5 or 10 years down the road. That is very expensive for the healthcare system, not only obviously very eventful for the patient, but you can ultimately save money by preventing those events, but you've got to make those investments up front.
Right, and that's a good point. Okay, I want to move on because I know we're approaching March break, and it has prompted a warning from Canada's top doctor over the global surge we're seeing of measles. We spoke about this last time that we talked, you and I, but what are your concerns as we head into the holiday when it comes to measles?
Yeah, particularly concerned, and I'll echo Dr. Tam's concern there that people are going to be traveling. This is when people travel all over the world, and measles right now is everywhere. It's resurging everywhere. It's not just sort of exotic locations anymore. Europe had 1,000 cases in 2022. They had over 40,000 in 2023, so a 40-fold increase there. We've heard about outbreaks in France, UK, Romania, Austria. There are outbreaks in all sorts of places. So there's a high chance that Canadians will encounter measles in their travels this March break. And if they're under-vaccinated or unvaccinated, they will bring measles back to this country. And unfortunately, We, like most countries, have had a drop-off in routine vaccination during pandemic times due to disruption of the healthcare system and a whole bunch of factors, which means that we probably don't have thresholds in most parts of the country for herd immunity in terms of measles immunity, which means if people do bring it back, we will very likely see outbreaks in Canada as they are seeing in other parts of the world.
Canada Tonight medical contributor Dr. Samir Gupta in Toronto tonight. Dr. Gupta, thank you.
Yeah, my pleasure.